All right, everyone. So thank you, Michigan, for Vaccine Choice, for this wonderful fundraiser, and to all the people on the panel for coming. And, I talk about whooping cough a lot because for a couple of reasons. One is that it is a really nasty disease, and we do need to do something about it. And I can understand why a vaccine was designed, although now that I understand more about vaccines, I think we need to start rethinking that entire thing and understand what other ways there are to treat whooping cough, and that's something that I do on a regular basis. Also, it's because there are major problems with the vaccine, with the effectiveness, with what we're told about it. And so tonight, I want to just outline some of that for you. And I talk about whooping cough a lot. There are several. Now I'm having feedback, right? Maybe should I give her this magnet or something? Here. Is that any better? Okay. So my YouTube page, sounds like there's horses running above us, has a lot on pertussis as well. I've just spoken in Australia and New Zealand about some of the things that I'll be repeating tonight, but because I don't like to give the same talk every time, I'm going to be focusing on maternal vaccination for pertussis tonight. But one of the requests was that I give some of my background to you all. And so this slide here is a picture of what my beautiful life used to be back when I was making $300,000 a year, and my office was where that blue arrow is, looking out onto that beautiful wilderness river. And I brought that dog right there to work with me every day. And I had a really happy life with people that I really liked working with in a hospital that was really nice. And I don't have a horse in this race. I don't have a vaccine-injured child. What I did is I saw problems in my own patients. And so what I started seeing was in 2009 that several patients started telling me that they were fine until they had that shot. And I was like, what shot? And it was as if they had told 20 people before me and nobody listened. So I was the one that had to listen. And so I looked around and I thought, well, it's a drug, it's a vaccine, it's an injection, maybe it can cause kidney failure. And lo and behold, there are numerous case reports in the medical literature. Now I understand there are mechanisms that we can, assume this kidney failure could happen. I saw chronic kidney conditions getting worse after vaccination. And 2009 was the year when we were giving 2 flu shots, one for the H1N1 and one for the seasonal flu. And that's when I really started to notice the problems. I started tracking it in my inpatients who would come into the hospital with normal kidney function. I would get a consult, kidney function had gone down. I look, there's a flu shot given within 24 hours. I say to the administration, you're going to be really interested in this because it's amazing what's happening with these flu shots, and you're going to really want to know about this, thinking that they were going to be wagging their tails saying, oh, we want to help. And this is pretty much what I got from the administration. Over the 2 years that I suffered through before I finally left of my own accord, I was pretty much told to shut up. I was censored, my charts were monitored. I was told that vaccines are safe, vaccines are effective, vaccines save lives. What about polio? What about smallpox? And what about herd immunity? We live longer now, everything in the book. And so I thought to myself, well, that's a really good question, because actually I don't know anything about polio, and I don't know anything about smallpox. And you know what? I don't know anything about tetanus either. And come to think of it, I really didn't know very much of the flu shot either, didn't know what was in it, and most doctors don't know what's in it. So I hit the books, and I hit the books really hard. And I was unbiased. If flu shots were good and safe, I was going to go in that direction. And if they caused problems, I was going to go in that direction. And over time, I found there were problems with every single vaccine. And so at that point, I started being more public about it, and I realized there's this pro-vaccine mob out there, which really shocked me, because they're very impolite if you don't know. And, they told me that, okay, well, that's fine, you're just a moron, or you're a homeopath, and because you're a homeopath, and I'm like, a homeopath? I'm a nephrologist, I'm an internist, I'm board certified, I'm dealing with some of the sickest patients in the world. What do you mean I'm a homeopath? And so that was it. I was a moron to them. So, I decided to go and retake my medical board, just to see if I was a moron or not, because I wasn't sure either. So I went and I took my medical boards, and so the red line is what you needed to pass, the green line was the average, and that one on the right, that was mine. So apparently, I must not be a moron. So now they say, well, even smart people can be crazy. So, this is the latest of the smart crazy. I'm now in the Encyclopedia of American Loons, and I am considered an MD turned crankery Sith Lord, and I'm a significant threat. So, thank you all for your support, and thank you, Encyclopedia of American Loons, for helping people find my website. So, since I left my job, I wrote 2 books, and the first one was Dissolving Illusions that I co-authored with Roman Bystrianic. And Roman kept sending me notices that he wanted to write a book with me, and I was like, who is this guy that wants to write a book with me? So he came to Maine, he visited, and we talked, and we decided it was a good team. And I reread the book last year, actually, and I still actually can learn from my own book. So even though I read it upwards of 30 times. But that book really was, the investigation of what happened with the death rates, and sometimes the disease rates, for various diseases, some that can be vaccinated for, some that cannot, or even scurvy. And we see that the death rates went down in just about every disease. We see that in some diseases, the actual disease rates went down. Not all of them. Measles disease rates didn't go down. But typhoid did, and it had to do with the environment and cleaning up, and most people are onto that by now. So what we did is we told the history around the graphs that were made from the vital statistics that even people that hate us don't refute. So a little bit of Dissolving Illusions will be in here tonight. And the second book is my autobiography, kind of an insider look at the medical system from the beginning of medical school. I pretty much take you through medical school, tell you what it's like to go through the doctor training and there afterwards, and then with my waking up and seeing what the problems are. And the intention is so that you can realize that you're not crazy people either, and that medical doctors really are miseducated, and you'll see exactly why in that book. So it's a very personal account of about a decade and a half. So let's start now with pertussis. So this is an article that came out in 2016. And they're scrambling now because they've tried a lot of things to try to get a pertussis eradicated. That was their dream initially, was to eradicate pertussis. And so there was vaccinating children with the whole cell vaccine. If you don't know, that was the whole bacteria that was used back until about 1990, I think. And it was more effective, but it was more, as they say, reactogenic, meaning it was killing people and causing encephalitis. So the lawsuits were so high that they had to come up with a different vaccine, or companies were going to go belly up. So they came up with this acellular vaccine, and that's what we use today. And there are major problems with that, and that's what I'm going to focus on today. So they said, okay, we're not doing a very good job at preventing pertussis in the community. We're not eradicating it, but we need to protect these babies before they can be vaccinated. From birth to 2 months of age, we need to do something. So they said, well, let's do this cocooning. What we're going to do is we're going to start vaccinating everyone around that baby, the parents, anyone who's going to be exposed to them. Well, it turns out that didn't work very well either. So now they're saying, well, we need to vaccinate mothers, pregnant mothers, while they're pregnant, because then we're going to boost their antibody levels, and they're going to be able to give all this wonderful stuff to the baby, and everything's going to be fine. Except that doesn't really work so well either. So infant mortality is something that has been tracked, along with a lot of the infectious diseases. And here you can see the top line are babies under 1 year. And that's really what the focus is on for a lot of these diseases, because in some cases, those are the ones that we can't vaccinate because they're too young. And so you can see the death rate was going down between 1900 is all the way on the left, and 1969 is all the way on the right. And then we go to 2001, and we've got 6.1 per thousand. Okay, these are all per thousands. And so the death rate had continued to decline even after 1969. And this is for all diseases, okay? It's just a mortality rate per age. Well, I wasn't going to show you this next slide, but a lady and her husband came up to me before the talk to tell me about their baby that died after DTaP vaccine, and that within 24 hours the child was incredibly sick, incapacitated with encephalitis, and died shortly thereafter. And there's usually at least one of these people in my audience. I've got friends whose babies died after the pertussis vaccine because the doctor said, your baby could die, you need this vaccine. And so I decided to look at the rates of death, thinking, well, what are the numbers in America, the death rates for pertussis? And so I went to the CDC and I went to the MMWR this week, and I just kind of tossed these together into a chart. And you can see that for about 2.5 years, between 1992 and 1995, there were 32 deaths in the less than 1 year olds for pertussis. In the 3 years, 1997 to 2000, there were 62, and that was for all age groups, not just the under ones. Then you can see that there's somewhere around 17 to 20, and then in 2013, 14, 15, 16, we see the death rate going down. Why that is, I don't know. There are cyclical patterns of pertussis. They comes every 3 to 6 years. Or could the maternal vaccines be doing something? I don't know. But I will tell you that even if they are, it's my opinion that it's not worth doing to save these maybe 11 babies per year is what we're looking at here. So that's really what I wanted to show you there. And then this is the overall United States pertussis death rates between 1920 and 1983. And where that arrow is where the first pertussis vaccines were used in a widespread fashion. So that's pretty much what Dissolving Illusions is about. We've taken several of the diseases to outline and tell you why we think that is and what the history of the vaccine development has been and what the successes and failures have been for those vaccines. So in 1975, there was this article that came out, and they were talking about, things dating back from 1960, but this was a workshop for the for the Journal of Infectious Diseases. It was from the National Institutes of Health. And they said some really interesting things, and you'll notice that I have references and PMID numbers after everything I tell you, just in case someone wants to check my facts or check if I'm a moron or not. So you can see here that in this paper they talk about that there's an emphasis that immunoprophylaxis can be carried out safely only when the natural history and pathogenesis of a disease is understood. Well, if that's the case, we probably shouldn't be vaccinating anybody. And then it says, in each condition considered at the workshop, this detailed knowledge was lacking when vaccine trials were initiated in man. Well, I can tell you, and you'll know by the end of the night, that these details are still severely lacking, yet you would never know it from the publicity and the pressure that parents are under today. So this is from the same article, and it says that production of circulating antibodies or induction of cellular immunity, or both, may be hazardous when local immune mechanisms of the mucosa are not operative. And this is really what this talk is going to be about, because the difference between a vaccine and a natural infection, an acellular vaccine anyway, is that a natural infection is going to give you that stimulation at the mucosa, at the mouth, the throat, the lungs. Whereas a vaccine doesn't necessarily do that, especially not an acellular vaccine. The whole cells might have done a little better, but not the acellulars. Although you'll see the whole cell is still nothing as good as a natural infection. So, vaccines were put on the market 200 years ago without knowing how they work. And, they didn't even know what a white blood cell was when the smallpox vaccine was released. And when Leeuwenhoek discovered the white blood cell, he was called a quack because he was looking under a microscope describing particles in the blood. So today, this is 2017, there's this article out here, and it says right here, they're talking about taking an AIDS vaccine. We've had problems in the past, but we still need to do it. You need to do the first round to give enough protection, 30 to 50% at a minimum, to show promise, even if you don't know how it works. They're okay with that. This is the ethos. Even if you don't know how it works, we need to do it, because apparently people are dying in droves of the common infectious diseases that we showed in Dissolving Illusions that nobody's dying in droves of anymore. So this article here comes from the Stanford University School of Medicine magazine, and it's some immunologists talking to each other pretty much. And they say some very telling things like the immune system remains a black box. Okay, this was in what year? This was like recently. I can't remember what year. I think 2013 or 14. The immune system remains a black box. And he says, if somebody asks how my immune system is doing, I would have no idea how to answer that. And I'm an immunologist, he says. None of us can answer that. Right now, we're still doing the same tests I did when I was a medical student in the late 1960s. And that's absolutely true. We do CBCs, basic metabolic panels, And most people don't do the kinds of things that Dr. David Brownstein and his colleagues are doing. So Gary Fadman, and one of the other doctors there, says that the immune system is staggeringly complex. He describes 15 different interacting cell types, spewing dozens of different molecules into the blood, and that they communicate with each other. So there's this very elegant orchestration that they admit that they don't understand, and that there are tens of thousands of genes whose activity can be altered by just about anything, including vaccination status. So, you know, over the past few years, they've been defining different kinds of T cells and looking at how they function and what their function actually is, and some of how they communicate with each other and how they respond to vaccines or don't respond to vaccines. And so, you know, Th1 and Th2 was a concept that we didn't really talk about when I was in medical school between 1989 and 93. But now we know that there are several other T cell lines that are all outlined here. This is a very simplistic schematic, even though it looks a little bit frightening. And then we look at this timeline here, and we see that, you know, I can't really see the date on there. Let me just make mine bigger. I can't tell what that says on the left, what year that was, but it was fairly recently. I think it says 86. The Th1, Th2 knowledge was beginning to become more clear. But the Th17 cell line really wasn't very well described until 2005. And so the point of these slides is just to show you that there's still a lot of discovery going on about the immune system. And they're admitting that, you know, they're willing to release a vaccine even if they don't know how it works. But then the science is supposedly settled, and, you know, in Australia they actually go on the news and they say, we don't want to hear from the health department says, we don't want to hear from the anti-vaccine because the science is settled. So we're starting to hear a bit of that now, but here's some of the settled science that was there until 2014, that there was no draining lymphatic system from the head, which is really interesting, isn't it? And then in 2015, they discovered the brain draining lymphatic system and admitted that every anatomical textbook will now have to be rewritten. So if we release vaccines before we know how they work, and we don't understand everything about the immune system, and we don't understand everything about the brain and the brain immune system, then how can any of the science be settled? Okay? And Dr. Mark Davis, we're still in the same article that I was talking to you about a minute ago, talks about all the moving parts and that we don't know what the vast majority of them do or should be doing. We can't be sure to tell when an immune system's not working right, or let alone why not. But we're told over and over again that autoimmune diseases don't happen because of vaccination. It's just chance. And he says we don't have good metrics of what a healthy human immune system looks like. Well, he's absolutely right about that. And then this article I just pulled up this week as well, 2017. It says right on here, when it comes to T cells, we barely know the half of it, and anything you write will almost immediately be out of date. How can we have science settled? So this is why we need corrupt epidemiological studies, because the science is really anything but settled. So let's go on to pertussis, whooping cough. And I told you that pertussis was once considered a candidate for eradication due to the pronounced early success of immunization. Well, let me tell you that the early success of immunization was for a few reasons. One was that most people in the population were older and were naturally immune. So that always makes herd immunity look a bit better. Two is that there was diagnostic bias. So if you had a vaccine, it wasn't even in the differential diagnosis that you could have whooping cough. And three is that they were using the whole cell vaccine, which was slightly more effective. Well, that dream has since then been completely destroyed for eradication. And we're now looking at vaccination continuously from the womb to the tomb. And the same happened with measles. We were told that measles would be eradicated with just one shot to part of the childhood population. And my parents believed that. And Dr. Sensor and Langmuir, these were some bigwigs at the NIH. And in this article here, they said effective use of these vaccines during the coming winter and spring should ensure the eradication of measles by 1967. They actually said this in 1967. The vaccine was released in 63. And there were major problems with it that we talk about in Dissolving Illusions. So, this is a pattern that I see a lot, is that the vaccine's pulled out, there's this honeymoon period, everybody loves it, they sign up for it, they think it's going to do something. It turns out it doesn't, and then we hear, well, there are always stumbling blocks, but all in all, we're still doing better. And so, yeah, we have to just keep giving injections over and over and over again. Okay, well, how's that going for us? This is from the California Department of Public Health. And you can go and find this. They stopped doing them in the past year, this particular chart. I think it got too embarrassing. But they all pretty much look like this. And you can see we're looking at less than 1 month olds up to 18 years old. And these are cases. Okay, so we're looking at 400 to 500 cases in the 10-year-olds that have had 5 doses of vaccine in their lifetime. You're looking at 300 in the 8-year-olds that have had 5 doses. The 5 doses are the yellow bars. 1 to 4 doses are the orange bars. So we can see that those multiple doses aren't quite even coming close to eradicating pertussis. And then this here comes from the Netherlands. And the Netherlands has a vaccination uptake rate of 96%. So we can consider that we could be equally weighted here. And what they found was that there's a 100-fold underestimation of the infections when they looked at the blood immunity values versus the vaccination rates. And so it's a pretty good article to read. I'm not going to get into the details, but the point really is that, this is what they're admitting to, and we know that it's probably 100-fold lower than what's really happening. And this slide here, this is on the CDC's website. I took this out of Edwards 2013. In 2012, rates of pertussis disease in the United States were higher than in any previous year since vaccines were first implemented. So what are we doing? Well, sometimes we're told that we have personal protection. If we just take our own shots, maybe we won't protect the herd, but we can protect ourselves. Well, let's look at that. So this comes from the CDC, and they talk about the Tdap vaccine protecting 7 out of 10 people who receive it, but that it fades over time. About 3 or 4 out of 10 people are fully protected 4 years after getting Tdap. And I can tell you this is a very optimistic estimate here, based on my own practice. So what's wrong with pertussis vaccine immunity? Well, something I talk about in detail in Dissolving Illusions is this concept of original antigenic sin, which was the first way they talked about it in the 1950s, which means that the way your body is programmed first, whether it's from a vaccine or natural infection, is the way your body's going to tend to respond later when a similar type of experience happens. And so since then, there have been different terms. Now they call it linked epitope suppression. We're now hearing original chemical sin. It makes it very hard to do a literature search when they keep changing the name of the same entity. But what's really interesting here is that, for the science addicts out there that might be listening, I want to show that they actually say in this article, and since then I've read numerous places, one of the problems with the acellular pertussis vaccine is that it's a toxoid vaccine, largely. It's got some other things in it too, but it's a toxoid, the pertussis toxin that's inactivated. And they had opportunities to do it 2 different ways to inactivate that toxin so that it wouldn't actually, kill you when it was injected. So they can chemically inactivate it, which actually changes the shape of the antibody that's formed because the shape of the toxin changes. Or they could have done a genetic modification production of it, which both are equally horrific, but the genetic modification production would actually at least help you make an antibody that would be more specific to help you fight the disease in the future. But for one reason or another, and even though they've known about this since the mid-1980s, they've decided to continue for non-scientific reasons with the chemically denatured pertussis toxin in the vaccines, which is one of the reasons why it's not working. This is another really great article, Diavatopoulos. And if you don't know, this video is being filmed, and we are going to put the slides on the film later so you can go and look these up yourself. This article blew me away, and it's very new. It came out in 2017, and this doctor here talks about how all the different things that go wrong in the immune system that make you not protected after getting this vaccine. And this is a conventional medical journal. It's a PubMed, National Library of Medicine article. And they talk about a certain subclass. So IgG, immune globulin G, has 4 subclasses. And so there's the subclass IgG4, which is more pronounced after repeated injections. They say doesn't bind complement. Complement is something that helps you break open bacteria, and so your spleen can chew them up. It says it results in suboptimal antibody-dependent complement-mediated killing, that there's a suboptimal inflammatory response. That's not good because we need inflammation in order to fight disease. So you need a certain degree of inflammation in order to get rid of whooping cough. That there's impaired phagocytosis, and that's basically how the white blood cells chew up the bacteria, and antimicrobial defense. And he talks about this skewing towards the Th2, and I'll talk to you more about that in a minute. And this is, remember I showed you this in the beginning, so I just want to go back here because it's complicated. I'm just going to keep trying to reboot. So the cellular immunity, circulating antibodies, cellular immunity is hazardous when local immune mechanisms are not operative. Well, let me show you what they mean by this. So this is a schematic from a very famous immunology textbook. And if you look at the panel on the left, so the top part would be the outside world, and the bottom part would be more close inside the body. And so you're looking at a normal, healthy, whether it's a skin or whether it's an esophagus or the stomach or intestine or the throat or the nose or the sinuses. But they're microbes. We're bathing in microbes. We're marinating in microbes. They're part of us. They're part of our immune system. And we need them. We need the right ones to be functional, to compete with each other, to keep the bad guys out. So normally, this is what everything looks like on the outside. So say you have a breach of that. Say something gets into a tonsil, or you get a splinter in your skin, or an ulcer somewhere. Then the immune system, the first layer, this layer is ready to go to work, whether you've ever had experience with an infection or not. And then your body can just kick it out. You get a little bit of heat going on there, and then you can heal up and go back to the left. Or your immune system can, for one reason or another, not be able to handle it, and you progress on to the next panel, which is you get more of a fever. So it's not just local heat, a slight fever. And then you have all that complement, the cytokines, the chemicals that tell the white blood cells to come in and come into action and start to do battle. And then you can get better and move off to the left. Or you can get worse and move off to the right. And that's when you can get higher fevers, and that's when you get the memory immunity. Okay, so that's what vaccines are aiming for. They're aiming to get to that right panel to give you an experience that you'll remember so you'll be ready to fight. But as you can see on the other 3 panels, you have tools, you have ability to go to battle with these invasions, whether you've been vaccinated or whether you've ever had an experience or not, or we'd all be dead because the common cold would have killed all of us a long time ago. So the point of this is to show you that even if you get to the far right panel, those first 3 parts of the immune system are going to continue to orchestrate in a layered fashion and keep fighting for you at the local level of the tonsil, inside the lymph nodes, in the spleen, in the blood. Your body's going to continue to fight until you get that memory immunity set. So for those of you that are visual learners, this is just another way to look at the same thing. And so the top one is the innate immunity, and that happens within 0 to 4 hours, the top row there, okay? The early induced innate response, that's 4 to 96 hours. Again, you don't need a vaccine or any memory. You can move along that. And then the last one is the adaptive immune response. And those red arrows are showing you that whooping cough is mainly fought in the lung lymphatics. It's fought at the surface. And then it later can be fought inside the lymph nodes, the local lymph nodes of the lung. And then the right side is showing you where a vaccine takes action. And it's much deeper into the system, so you don't get that surface level response. And so it's very different. And in the end, especially when we're using killed vaccines, and that's what whooping cough vaccine is, it's detoxified, it's killed, it's a subunit, it's got pieces of a bacteria that's dead. And in order to make that work properly, you have to add a lot of aluminum to it. It's called an adjuvant. Whenever you add aluminum adjuvant, with the exception of the flu shot, which doesn't have aluminum, the killed vaccine, you end up with that Th2 antibody stimulation, okay? So that's why I made that box bigger. Now, if you had a measles shot, you'd have more of a Th1 response. Okay, that's a live vaccine. So most vaccines that babies get, especially up until the first year of life, are killed. Okay, the only one that's not is the rotavirus vaccine. So all those other vaccines are giving that baby and that mother aluminum and a Th2 response, inflammation. And if you don't know it, pregnancy, everything about the pregnant status is meant to be anti-inflammatory so the mother doesn't reject that baby. Okay, so just keep that in mind. Now this is just another pretty little, I like graphics because they kind of tell a whole story in one picture. And so on the left, again, it's the lung surface, and that's where the bacteria take hold, and then they call in, you know, the troops, and they hold the bacteria there at the lung, and then you're finally cleared of the bacteria on the third panel, and all those different cells, neutrophils, cytokines, interleukin-17, interferon gamma. Remember, interferon gamma, it's going to come up later. And then you get memory to it. And the memory, if you have a natural infection, lasts about 30 years. The memory after vaccination, depending on how old you are and how many vaccines you have, can be anywhere from 3 months to 4 years. So this is a really great article, Brummelman, that describes a natural history of natural infection versus vaccine immunity. Okay, so again, getting back to Divertopoulos, who I mentioned just a minute ago, this doctor talks about something really interesting. This is why I nearly fell off my chair, because for years I thought to myself, now wait a minute, when you give allergy injections to make the immune system stop attacking, you have to keep going back and getting more and more and more of them. And the more you get, the more the body tends to tolerate it. Well, why would vaccines be any different? I'm scratching my head for years. And allergy injections have far more aluminum than these vaccines have. Well, it turns out that the vaccines do the same thing. And this guy explains it in great detail, that the repeated booster doses of the acellular vaccine in babies who have gotten the acellular vaccine as their first vaccine leads to more IgG4, which is going to lead to more allergy, greater Th2 skewing, and much higher antibody production than the old whole cell ones. And also, he didn't talk about this, but it's true, in natural infection. And he says that acellular prime children have a progressive loss of protection, which with each vaccine they get, they respond less and less and less. And again, I like diagrams. This is another diagram. I know it's probably not easy to see for you people in the back, but what I want you to know is that the first response is IgG3 normally. Second is IgG1, then 2, and then 4. That's the normal course of things in a natural infection. Well, with the vaccine, which is at the bottom panel, you can see that you get a much higher proportion of IgG4. And that's really what's leading to a lot of the problems. That IgG4 doesn't bind complement, which is part of the immune system, that helps the bacteria be punctured. These kind of encapsulated nasty bacteria like pertussis bacteria. It's a very nasty bacteria, don't get me wrong, very nasty. And so this doctor outlines, in that bottom square about the reduced antibody-dependent complement-mediated killing, the reduced inflammatory response, all the things I just went over with you. And then he says that IgG4 antibodies strongly correlate with the total IgE production. Now that's allergy. IgE antibody is consistent with allergy. In these acellular pertussis vaccinated children, indicating Th2 skewed immune responses. Okay, that's settled science. And even vaccinologists, immunologists, they'll tell you that, yes, you do get a Th2 skew. Yes, you do get a lot of antibody. But they'll still tell you that it's worth it because having antibody will protect you. We'll see about that. So he talks about these elevated IgG4 levels being present in children who had received repeated numbers of acellular pertussis vaccinations. Actually, that's another author, Hendricks. So again, these findings suggest that repetitive acellular vaccination may lead to early exhaustion of cellular immunity. Okay? So antibody is actually the last thing that happens, especially IgG, when you're infected. The first thing that happens is all that local immune response, cells get ramped up, the Pac-Man eating cells. And then the last thing that happens is antibody. And antibody feeds back onto the cell battle and says, okay, we're good, we did the job, calm down. So now you can see why, if you're injecting a vaccine that immediately leads to high levels of antibody, why you might not have such a great cell-mediated response. And the cell-mediated response is what's key to actually fighting off the bacteria and having memory to it later. And the same phenomenon has been proven with influenza vaccines. So this just is a summary of vaccine versus natural immunity, kind of summing up what I've just told you. That the vaccine just has parts of the bacteria. The natural immunity, you get a full bacterial spectrum. There's lots of antibody with the vaccine. It's the wrong shape because of that chemical sin that I talked about. You get more blood stimulation rather than lung stimulation, and you get that IgG4 that dampens the cell-mediated immunity that you need. And there's also this phenomenon of a blunted response. So if you get the vaccine, successive vaccines, you will have a blunted response. But if you're a fetus and your mother had a vaccine while she was pregnant with you, then when they go to vaccinate you later, you will have a blunted response because of those antibodies that the mother gave you. So that's another problem. So, all right, that kind of hits personal protection. And personal protection is really important because we keep hearing about herd immunity. Well, how can you have herd immunity if you don't even have personal immunity, right? Because that's how you stop disease, is you don't spread it. Well, how do you spread it? You have to have it to spread it. So now we know that personal protection is not a given by any means with pertussis vaccines. So let's look at transmission. It's well defined in the medical literature. Again, this is not fringe, tree-hugging, hippie theory. This is PMID, National Library of Medicine, published, well-known facts here that the transmission rate, there's a resurgence in pertussis, and they're now talking about it openly due to deficiencies in the acellular vaccines, that there's failure to prevent the transmission, and it's ineffective at inhibiting shedding and transmission. And this article here is really important. I think this author probably regrets the day he did this study because a lot of us have not let go of this one. And he did this study on baboons, and his conclusion was that they failed to prevent colonization or transmission when those baboons were vaccinated. So baboons manifest pertussis much the same way that humans do. And so he decided to vaccinate 3 groups of baboons. So one group, they gave the old-fashioned vaccine, the whole cell vaccine, at 2 months, 4 months, and 6 months. And one group, he gave the acellular vaccine, the one we use today, 2 months, 4 months, 6 months. And then one group of baboons got infected with bacteria up the nose. And then he decided to wait 1 more month after they were all recovered from their vaccines and from their infection. And at 7 months, he re-exposed them all to the bacteria by intranasal inoculation. And what he found was a surprise, even to him, is that the baboons who got the old-fashioned vaccine that was supposedly so much better still shed bacteria for 18 days after they were re-exposed. Okay, so it's not because the vaccine sheds, it's re-exposure to the bacteria. The immune system isn't fighting very well because it's not fighting at the lung surface. So they're shedding bacteria from the lungs for 18 days. That's the good vaccine. Okay? The one we use today, they shed for 42 days, even though they didn't have symptoms, okay? So these baboons had no symptoms, they weren't coughing. This is grandma who gets bullied into getting the vaccine so she can be around baby, okay? She's not coughing, but she has the potential to shed bacteria if she's in the vicinity of it for 42 days and asymptomatically give that to the baby. And everyone will say, we don't know where it came from. It's these unvaccinated kids. Well, the unvaccinated kids are represented on the right. They're the ones that had the infection, recovered, and then were re-exposed. They couldn't find any bacteria in their lungs after they were re-exposed because they had that solid lung immunity. And then the second part of the experiment, they exposed them to what I consider naive baboons that have no experience with the disease and no experience with the vaccine. Okay, this is the newborn baby who presumably the mother had never had the disease or a vaccine, totally naive immune system, exposes them they didn't expose them to the whole cell vaccine. And if they did, they didn't publish the data because it might have been, again, too embarrassing. But the vaccine that we use today, when they put that baboon who had the vaccine that we use today and was re-exposed to the pertussis bacteria, infected the cage mates. Okay, so that's proof that grandma can infect your baby, even if you make her get a vaccine. And then the ones that were recovered from the infection, when they were put in with the naive baboons, there was no transmission. Okay, so this paper is monumental and speaks volumes. And I just throw this in here because this is also a relevant phenomenon when it comes to herd immunity. And that is, this is a case report from 2017 of somebody who, I think she's 40 years old. She had pertussis naturally at the age of 10. She got antibiotics at the age of 10. And they're presuming that she got pertussis again because she was treated with antibiotics. So what did they do? They gave her antibiotics again when she had her infection. And then they vaccinated her after she was recovered because they said, you're probably not immune because we gave you antibiotics. But the long and the short of it is this is an admission that the common practice of prescribing antibiotics to children who have overt coughing, we know that it doesn't help the cough. Unless you get in very early in very young babies, just for maybe 2 days is what I do. But aside from that, no antibiotics. They usually make the cough worse for reasons I don't have time to get into today. The point of this is that the antibiotic can actually keep the immune system from going through that entire phase that I showed you, where you can get that memory immunity. Yet antibiotics are the #1 thing that a conventional medical doctor will do if you bring a child with whooping cough in. They don't know that it won't work. They're trained to think that it will decrease the shedding, and to them that's the most important thing. And it doesn't even always do that. So there's a major problem with mutant strains, and what's happened as a result of everything I've just told you about how you have inferior immunity at the lung surface, about how the blood is programmed wrong, about how there's blunting of the immune response, about how it's the Th2 rather than the Th1. And because we have this bacteria that stays in the lungs for all this time, mutations have occurred in the microbiome of the Bordetella pertussis bacteria species. So this is just the baboon study shown to you graphically. And so the blue line on the top is a naturally infected baboon, and that's how long, that's how much bacteria they find on the y-axis over time on the x-axis. And you can see that, just what I showed you, that the naturally infected baboon and the acellular pertussis vaccinated baboon, upon exposure, both shed bacteria. But the green line at the bottom is the recovered baboon, who is then exposed and sheds no bacteria. So with that in mind, know that it's been found, and was first noticed in the Italian population, that this problem is prevalent in vaccinated populations. And it should make sense now, because you want to have bacteria around for a long time, dividing, inefficiently being fought, and so the bacteria can be smarter and mutate and change their genes in the process of trying to survive. And who do they survive better in? Vaccinated people, okay? So we're finding these mutant strains in vaccinated populations. And now it's very well accepted. We know it's happening in Finland, the USA, Japan, and France. This article is out of Australia, and the clear boxes there are showing the mutant strains that have evolved since 2008 on the left to 2012 on the right. And you can see that they've pretty much taken over as far as the predominant species of bacteria that circulate in these mutant strains. And so the mutation is in something called pertactin. And it's another toxic factor that helps the bacteria survive and fool your immune system. And so that pertactin is actually missing in the mutant strains. And you might think that's a good thing, but it turns out not to be a very good thing, and I'll get to that in a minute. So they're talking about this here about in the 2 regions of Australia where isolates were available for all years between 2008 to 2012, that the mutant strains went from 10% to 80% of the total species that they were measuring. And so the problem is with these PRN, or pertactin negative strains, is that, guess what? That antigen is the most effective antigen of all of them in the vaccine to induce functional antibodies so that the body can respond and fight it. So now we're missing a necessary antigen in the vaccine. So that means when the bacteria comes along, the immune system that's been primed by a vaccine can't fight that as well either. So mutant strains are missing the antigen, and that's the antigen that the vaccine makes the best match of antibody to. So this is just, another write-up in the Disease Daily about vaccine-resistant whooping cough found in the USA. This is 2013. Just basically discussing it, saying that the vaccines aren't effective against these mutant strains. So now we've got vaccines that they're admitting have created mutant strains and that the vaccine immunity can't work. So why on earth are we giving more vaccines as a solution? But that is what every single article that describes this phenomenon finishes by saying, well, we shouldn't stop vaccinating just because of this. We just need to be giving more of them more often and not letting people go without being vaccinated. So this, strain that's missing, that antigen, has a higher ability to invade the body. It also, some of these strains have higher toxin production. So it's not just this protactin negativity that these strains, this is a paper on the CDC's website basically talking about this. It's very well known. And in Italy, there are doctors that are saying, hey, we're having a major problem here, that the circulation cannot be controlled at all, despite having really high levels of vaccination coverage. What are we going to do here? We have a major problem. We're questioning the effectiveness of this immunization program, and Italian doctors are waking up in droves, and we saw what just happened to Italy. So this is another article, Hoving, again, talking about the reason for this. I think I'm beating the dead horse now. But I'm just giving you reference after reference to show you that I didn't just cherry pick one article to show you the problems that we're having with, you name it, that I've been through today. Warfel, the baboon study author, says key differences in T-cell memory suggest that acellular pertussis vaccination induces a suboptimal immune response that is unable to prevent infection. So again, is the science settled, and should we be really following orders to vaccinate from womb to tomb with this vaccine? So today's pertussis vaccines impair meaningful herd immunity. They cannot eradicate whooping cough. They cannot prevent transmission. They provide defective, limited personal protection and yields to mutants that have a higher invasive capacity. Don't you think it's a bit mad to be recommending this vaccine to every pregnant woman, to 2 months, 4 months, 6 months, 1 year, 4 years, 11 years, and then over and over and over if you're having grandchildren? All right, so this is the last part of my talk, and I've never talked about this publicly before. So this has to do with the maternal protection between the pre-vaccine era and the post-vaccine era. And this article is actually from the New England Journal of Medicine, okay, the Bible of the vaccine religious here. And it's from 2005. And what's funny is that they put this chart in there, but they didn't actually talk about the chart. I think somebody just kind of got to slip this in here somehow. And so what you see on the top is the pre-vaccination era, and on the left are the susceptibles, and on the right are the immune. And the susceptibles are the young children who would get natural infection, and then they would go on to become adolescents and adults and be immune. And then the infants were immune because the mother gave them immunity. It's just like measles. It's a parallel, okay? Then post-vaccine, look who's in the immune category. One group, the children that have just gotten their series of vaccines. After that third vaccine, there's a period where they're less likely to get the disease or shed the disease. Well, look at all the people on the left. So your newborn baby, the mother, the adolescents, and the adults. That's who we're seeing getting pertussis today. Not just garden variety pertussis, but mutant strain pertussis. The same article talks about it. It does talk about it under the picture. You know how they have the little narrative under the picture. So it just says just what I told you about how the mothers used to pass protection to the infants through the placental transfer of antibodies. They also pass it through the colostrum if they're breastfeeding, but breastfeeding has gone out of vogue, starting in the 1950s and 60s, and finally started to come back again. But that is a big factor in passing immunity, and I'll get to that in a minute. And so they're talking about the increased proportion of cases occurring in those susceptible babies in the older population as a result of vaccination. This article I've already showed you this first page of again, about how they had hoped that the disease would be eradicated. So this is about vaccinating mothers and what the potential clinical gains and epidemiological legacy is. There's a lot of truth in this article. And it came out in 2017, and they're really, they're basically going like this and saying, well, some of our studies show that the baby does respond after we vaccinated the mother if we vaccinate the baby, but a lot of our studies show that the baby doesn't respond to the vaccine if we vaccinated the mother while she was pregnant. That's called the blunting effect, and we don't really know. We have to keep studying it because we think it's a problem, but we don't really know what to do about it. And so that's why they're now thinking of giving mothers stronger vaccines right before they deliver so that they can have lots of antibody to pass on to the baby. This is Bento again. He's saying we need to establish whether interference leads to an increase in vaccine failure, reduces the protective effects of the vaccine, or affects the duration of protection, because they know it does. They're saying, help! We know this is a problem. We need to figure this out. This article, this is a great one too. What they did, this is one of my favorite, I should say, probably pro-vaccine scientists, Elahi. And he did some studies that I talk about in my infant immunity series because he very eloquently described how the infant immune system is clamped down for the first 2 years while it's learning from its mother's immune system through breast milk how to respond to the environment. This is the scientist that pretty much broke this down in very good detail. Well, he came out in 2017 with this really interesting study, and I kind of feel like he knows there's a problem, but he has to be really careful about how he talks about it. And so what they did in this study is that they took pregnant sows and they vaccinated them not with the acellular vaccine, but with the whole cell vaccine. Why? I don't know. But they vaccinated them with the whole cell vaccine. And then they measured the amount of cytokines and antibodies that were generated in the pregnant sow, and then they measured what came out in the baby when a piglet was born, and what was coming through colostrum into the piglet, and then they exposed the piglets to the disease. So they vaccinated the mothers and then exposed the piglets to the disease after they were born. And then they dissected their lungs and looked at all these different things, and they came out with some really interesting conclusions. Now remember, they used the whole cell, which is more similar to having natural infection. And they showed that it produced a wide range of cell-mediated immunity, of cytokines, which are those chemicals that call in the immune system, that tell the brain to increase the body temperature. And it called in antibodies. And the cytokines and antibodies were transferred to the piglets. And that the piglets were protected after they were exposed to the bacteria, and that the piglets that didn't have vaccinated mothers weren't protected, and their lungs were in much worse shape. And they emphasized this gamma interferon importance. That's one of the cytokines that helps the cell-mediated immunity. He seems to think that's a really important factor here. And I said the control offspring weren't protected, but remember that pigs don't live in society like we do with circulating whooping cough, that they're able to generate herd immunity, like the mothers can get natural disease and pass it on to the babies. That didn't happen with these pigs, and it didn't happen with the baboon study, and that's a real limitation, because if it did, some of those control piglets would have been protected, okay? But the vaccinated newborn piglets, they vaccinated some of the newborns just to say, well, let's see when we vaccinate some of these newborns if they're able to respond and if they're protected. And they did respond. They had a wonderful antibody response, and that's what vaccinologists look for, but they found that it didn't protect them, okay? So the main points here are that cell-mediated immunity is protective. We need the Th1, Th17, and gamma interferon. You don't get that with acellular vaccines, the ones we use today. That this kind of immunity, which you also get naturally, can be passed to the newborn through the placenta and through the cord. I've got another study that shows that the maternal blood level compared to the cord level of those cytokines and antibodies, it's far higher in the cord than it even is in the mother. And that's one of the other interesting natures of pregnancy, is that the design is to extract what that baby needs, even at the expense of the mother. The vitamin C will get drawn out of a mother into the cord and the placenta and the baby. And so if the mother doesn't have enough vitamin C, it doesn't matter. The baby is still priority. And that later they found that these substances came through the milk and that were able to get through because the intestines of a newborn aren't totally closed. They're kind of leaky in reverse. They could draw in all that good stuff from the colostrum. And they found that it not only got into the piglet's body, but it got into their lungs. Okay? That's really interesting. And so it was able to protect their lungs that way. They actually found those cytokines in the newborn piglet's lungs. And that it lasted beyond the gut closure time, which is about 7 days in a piglet. And it lasted beyond the phase of colostrum production in the mother. They didn't test the acellular vaccines, and I believe the reason they didn't is because they know the results would pale in comparison. And so I keep saying to myself, well, what about natural immunity? Why aren't they getting one arm of these sows and inoculating them and then seeing what happens after the piglet's born? But they're not yet anyway. This is another, I'm almost done. This is another interesting article where they did something similar, and they took two groups, some African women, I'm trying to remember where the other group came from, some American women, and they looked at their colostrum levels and their blood levels, and they looked at the infants' levels, and then they took the blood from, okay, so they got these mothers, they vaccinated the mothers, and then they had their babies. And then they took the baby's blood, the human blood, although because the Americans wouldn't let them take the baby's blood, they only took it from the Africans. And this is another problem with research. So they took the human blood and they inoculated it into the brains of mice. This is disgusting. I mean, I wish it would all be over with, but this is what they're doing. So they inoculated it into the brains of mice, and then they exposed the mice to bacteria. And they found, again, just a pretty similar thing to the sows, that the human maternal blood, the infant cord blood, the colostrum samples were evaluated. They found a very high ratio of immunity in the cord blood. Again, everything's being prioritized given to that baby. The bacteria was then mixed with human samples. I already told you this. So they found that the colostrum sample, this was just an aside, but I think it's probably the most important part of the conclusion, is that there was one mother who had selective IgA deficiency. That's the immune globulin that's in the lung surface. And they said that even though she had immune globulin deficiency, that her blood, her colostrum sample, was able to protect 45% of those mice. Okay? And they said that indicates that bacterial neutralization may not be solely because of the functional activity of specific antibodies, and suggests that other anti-infective factors present in the human serum and colostrum may contribute to non-specific bacterial neutralization. In other words, it's more than antibody. We know this. It's more than just the cells. There are soluble factors in there. There's a whole orchestration of tens of thousands of genes being upregulated, spewing chemicals, talking to each other. They have no idea what's going on there. But there's something that they're not measuring that the vaccine can't produce. It's interesting that several studies have demonstrated that IgA antibodies are not produced after vaccination with whole cell or acellular vaccines, and only natural infections produce this secretory SIgA production in the respiratory tract. Hello. So again, he's talking about these other factors that must be there. There's something more than just antibodies responsible for that protection. And no studies have yet assessed antibody responses after maternal immunization with acellular vaccines. Those are the ones we're using today. Well, there is this study here that was looking at something else, and I just happened to notice this chart that was there. And the chart showed adverse events after giving the acellular vaccine to pregnant human women. And they found that there were 11 adverse events in the vaccine group and 3 in the control group. When you look at the total number, it works out to 18.9% of adverse events in the vaccine group, 7.3% in the control group. Some of these adverse events were pretty nasty. Preeclampsia, eclampsia, premature contractions, hypertension. The conclusion was that it wasn't the vaccine and that it was no more than background noise. So we shouldn't be worried about this. So just to wind up, these are the questions that I think our legislators, our scientists, our immunologists our medical doctors that are pushing these vaccines on pregnant women and newborns need to consider. If the wrong immunity is made after the acellular vaccines in children, why would you give them to mothers with an idea that the baby could then be protected afterwards? It's not. What are the implications of immediate cord clamping? Now that's just a common practice, even though the American College of Obstetricians and Gynecologists say that we shouldn't be doing this, that it's not necessary. Obstetricians are creatures of habit and tradition, and they continue to immediately clamp that cord. And you're not just depriving that baby of up to half of its birthright blood supply, stem cells that are anti-inflammatory that can go and mop up the mess that can happen in a brain during birth, and serve that person for the rest of its life, but also all that immune globulin that gets passed. Remember how much was in the cord? Well, if there's more immune globulin in the cord than even in the mother, why on earth would you put a clamp on that cord? It's supposed to go into the baby. So what is the implication of immediate cord clamping? They don't talk about it. They never bring this up in any of these studies. Never, ever, ever. What are the implications of infant formula? Remember, I showed you the colostrum was rich in the T cells and these soluble factors, interferon gamma, that the baby's absorbing this through its gut. It's getting into the lungs. Well, guess what? Formula doesn't have any of that. Nothing. Never mentioned in any of these studies on humans. None of the epidemiology studies are looking at cord clamping. They're not looking at breastfeeding. They're just looking at epidemiology and analyzing it in their fancy ways and coming up with conclusions that don't fit the actual biology and immunology. What about the blunting that I talked about of the baby's response because the mother got a vaccine? What about the antibiotic treatment that's knee-jerk to every child? Okay, so if every child gets an antibiotic, whether they're vaccinated or not, they get pertussis, they get an antibiotic, they're not immune. They know that. So that's not helping herd immunity at all. Why are antibodies such a strong focus in vaccine effectiveness and vaccine studies? I just showed you several different studies that talk about how they're not that important and that there's far more important things going on. The antibodies are not necessarily going to protect the newborn. Why aren't acellular vaccines studied properly before recommending them to pregnant women and babies? And is the science really settled? It's not. I mean, this is Elahi again in 2016 doing a review article. And here saying, despite intensive research on the pathogenesis of and immunity to B. pertussis, many important questions remain. The length of bacterial carriage, the efficiency with which asymptomatic carriers can transmit infection. See, he knows all of this. He knows everything I just told you. Immune correlates to protection, meaning we don't know what to measure to decide if somebody's immune or not. And the nature and duration of the immune response after infection and immunization are among the unresolved issues. Well, that's just about everything, folks. Just about everything is unresolved in terms of this vaccine. So this is the article that just came out this week that's all a buzz. If you don't know about it, it's an article you need to know about because this was about influenza vaccines given to pregnant women, and they specifically measured them in the first trimester. And you know, all the newscasts are all saying, the medical professionals are telling you not to look at this article, don't believe this article, just one article out of many. You still need to be vaccinating pregnant women for influenza. Do not listen to that, do not listen to that, do not listen to that. So the conclusions, among other things, and it wasn't a perfect study. I'll be the first person to say it wasn't a perfect. I finally got it. I paid $35 just so I could read it before I got here today. It's not a perfect study by any means, but it's pretty darn good. And I don't think that the investigators ever thought that this is what they would come up with because most of the other studies don't have this conclusion. But what's interesting is that they looked at the vaccine data link system, which is the one that Robert F. Kennedy has been trying to get access to so that we can study the actual linkages between vaccination and adverse events within large HMO populations. Well, they did that, and that's how they got this information. And they found that the overall odds of vaccine exposure in the 28-day exposure window was increased by a factor of 2. So that means that the abortion rate was twice as high in those vaccinated in the first trimester. A secondary analysis suggested that the odds among women who were also vaccinated in the previous year with the H1N1 containing vaccine was almost 8-fold higher, and it was statistically significant. So, you know, I think there's going to be a lot of effort to come up with 20 more studies that show that this isn't true in the very near future. So, you know, one of the things I've been focusing on is, well, what do we do about this? You know, if my philosophy is that no one I love or care about is ever getting near a pertussis vaccine, or any vaccine for that matter, because I'm informed now, as opposed to when I went through medical school and residency and was told nothing about vaccines except for when to give them and how important they were. I've spent the last 8 years studying vaccination, and I would never give a vaccine to anyone I care about. I would never take a vaccine unless it's under gun control. And, you know, if I thought vaccines did any good, believe me, I would say it. I would tell you if I thought that there was, you know, but there's always, and you have to understand what you're doing, you know. Not vaccinating is not for everyone. You have to, in this world today, because you're treated so harshly, if your kid gets sick with anything, their arm could be falling off and they're going to be told that they need a pertussis shot. You know that in the emergency room. So you have to know what you're doing. You have to have your facts clear, and you have to be able to deal with diseases whether your kids are vaccinated or not, because the medical system is just not that great at dealing with acute infectious diseases of childhood. And how you deal with acute infectious diseases of childhood has everything to do with the integrity of that child's immune system later in life. So vitamin C is something that I have recognized as effective in many different infections, but it's highly effective in dealing with the whooping cough. And I've dealt with babies as young as 2 weeks old. That's as early as you can get whooping cough, and adults up through their 60s. So far, so good. Okay, I've dealt with hundreds of children and babies. There are lots of testimonials on my website. I'm not selling you anything. This is one of the cheapest things money can buy, is sodium ascorbate, the synthetic drug of vitamin C that will save your child's life. And I think that everybody needs to understand that. And this is free. You can go on my website, drsuzanne.net. I'm about to republish a new version of this that will be updated. But please understand the use of vitamin C in any child at any age. You have to know, again, what you're doing. There are downsides, potential downsides. There are do's and don'ts when it comes to vitamin C. There's a right way and a wrong way to do it. And again, thank you. That'll be it.